When dawn broke on the 5th of March 2020, it marked the start of a daunting new chapter in our nation's history. On this day, the Minister of Health, Dr. Zwelini Mkhize, announced that the first positive COVID-19 case was confirmed by the National Institute for Communicable Diseases, making headlines across the country.
First case of coronavirus in South Africa has been confirmed.
Before the news emerged, however, the determination and resilience of our outstanding scientists and epidemiologists had been in motion to ensure South Africa's response to the pandemic months before COVID-19 reached the country. December 31, 2019, when the World Health Organization reported a cluster outbreak of pneumonia cases in Wuhan, China, news of this outbreak rapidly reached South African shores, placing epidemiologists at the NICD on high alert as they kept a keen eye on global trends.
So in the beginning, it emerged in Wuhan, and then a lot of countries started picking up cases, and we knew South Africa was at risk for the virus coming in through travelers. So at that time, our focus was really on travelers and having in place the systems to identify a possible case. So I think that was the focus really at the beginning, before the virus was in South Africa. With us, as the pandemic came up, and especially at that beginning time, it was really this extreme and intense period of activity. And I still remember during the lockdown, so many people in the lockdown had a sort of otherworldly experience of being at home and restarting yoga and reading books and being with their kids and homeschooling. And for myself personally, and those of us at the NICD, it was the opposite. It was like we were driving through these empty streets with no cars there, but we were completely stressed, working long hours. I think that also was quite exhausting and emotionally demanding.
On 7 January 2020, it was reported that the pneumonia outbreak was caused by a new strain of coronavirus. The rapid pace at which the disease was spreading globally was indicative that South Africa would not be spared. This prompted Dr. Janal Biman at the Center for Respiratory Disease and Meningitis team to develop diagnostic testing, which would be critical for South Africa to detect the virus. These tests would later be rolled out on a national scale in the public and private sector.
I was involved in developing the first diagnostic test here in South Africa. This was really important and critical for us to do so that we could pick up when cases were coming into the country, because previously there were no diagnostic tests available to pick up this virus. At the time, it was quite challenging to orchestrate, purely because there were a lot of travel restrictions already in place. It took a lot of negotiating with suppliers. It also took a lot of collaboration with international scientists who were offering to assist. So the first things that we needed were what we call primers and probes, and these are basically little pieces of DNA that bind to the viral components and say, hey, here I am, with these bright shiny lights. The second things we needed to get were controls to say if our assay is actually working or if it's not. So luckily we were able to get those controls from international collaborators. The pandemic, as with I'm sure everybody in the world, had a huge impact on my personal life. Firstly, the 5th of March is a day that will always be very memorable to me. Last year, when we detected our first positive, it was my daughter's first birthday. The plan was Janelle was going to have a day off to celebrate with her child. That didn't happen.
Before specimen testing commenced on 28 January 2020, the laboratory was transformed into a high-function diagnostic workspace where guidelines and regulations were modified at a moment's notice as new information about the coronavirus emerged. Seemingly insurmountable challenges and immense pressure paved the way for a team that showed tremendous resilience in defying the odds.
In the molecular laboratory, we are responsible for numerous testing, predominantly PCR testing, and we do this for different platforms, so for surveillance and for diagnostic purposes. During the outbreak, and especially in the early stages of the pandemic, we essentially had to re-engineer all the processes in our laboratory to accommodate the testing. In any laboratory really, there is a process of specimen logging. Once you've done that, then the specimen moves into the processing laboratory or the molecular laboratory. And there's essentially two steps. The extraction process, so it's the genetic material that needs to be extracted out of the virus, and then it's the PCR process, which is what we call an amplification process, so that we can detect and visualize the virus. And at the end of the test, there is a stage where we have to look at the results. We have to make sure that everything has worked, that all our controls have worked. So there are checks and balances, there are quality management steps, and those results need to be reviewed and authorized by somebody before they can be submitted to the sender or to the doctor.
The aggressive spread of the coronavirus left the World Health Organization with no alternative other than declaring COVID-19 a global health emergency on 30 January 2020. In the South African context, this meant an information hub referred to as an Emergency Operations Center would be activated, playing a strategic role in emergency preparedness and management of the outbreak.
An Emergency Operations Center, shortened to EOC. The role of an EOC is to be able to coordinate those essential, really important resources for the efficient management of a public health emergency. In South Africa, our one that is currently sitting in is fairly new. In terms of systems, for the call center, we had a data capturing system in place for collation of the telephone calls and queries. The ICT infrastructure within the EOC has been available. The provision of personal protective equipment. We did our best to procure large amounts of personal protective equipment. We recruited a large number of staff in terms of epidemiologists. We also provided some provinces with deployments of epidemiologists. So the EOC really did fulfill its function in that regard in terms of deployment of essential resources for the response. I actually recently lost a friend who was a big supporter of the EOC, consistently reminded me how fortunate I was to do what it is that I do, and that I should never forget that fact. In everything that I do, that I'm giving back. I barely saw my family the first few months, and I actually felt terribly selfish. In addition, my wife's an epidemiologist working here at the NICED, but yeah, I guess it's just a strange time. Nothing prepares you for a pandemic.
With much remaining unclear about the coronavirus, including clinical features of the disease and its severity, some tough questions had to be answered.
We were very fortunate in South Africa. We had adhered to the guidelines for emergency preparedness. And one of the components of that is the availability and the preparedness of or existence of an emergency operations center that uses what's called the incident management system. So the incident management system is essentially a hierarchy with a number of, an overall coordinator and then a number of team leads. One of the challenges was that very little was known around the clinical presentation and management of this condition. We also developed and worked with a committee of infection prevention and control practitioners to write infection prevention and control guidelines. History unfolding in the sense that, from medical school, we'd been learning about this global pandemic of influenza that was going to sweep across the world one day. And there we were sitting in the middle of this global pandemic that had just started in my lifetime. It was something quite intimidating.
These are the events leading up to the detection of the first COVID-19 case in South Africa. As a nation, we have demonstrated extraordinary resilience, a spirit of hope and unison in a time that can be defined as one of our darkest hours. And as we reflect, we honor those who continue to lead the COVID-19 fight and pay tribute to those who were tragically lost.